So welcome everybody. Today we are going to discuss about hydrocele, right? So what's hydrocele? What are its clinical features? What are its types and its signs or tests that we perform to diagnose hydrocele? The investigative tools, the management, right? So basically, the word hydrocele, it means a bag of water, right? Hydro means water and seal means bag, right? So the hydrocele means bag of water, literally. So definition, it is defined as an excessive abnormal accumulation of serous fluid in the tunica vaginalis of testis, right? In the tunica vaginalis of testis, the layer covering the testis, right, tunica vaginalis, in that layer, right? So if there is excessive abnormal accumulation of serous fluid, so that is known as hydrocele, right, due to any cause, right? That may be primary, that may be secondary, right? So the etiology, it is the postulated hypothesis regarding the etiology of hydroceles are defective absorption of serous fluid by tunica vaginalis, right? The tunica vaginalis, there is defective absorption and excessive production of serous fluid by tunica vaginalis, interference in the drainage of serous fluid by lymphatic drainage, and patent processus vaginalis. Patent processus vaginalis. Composition of hydrocele fluid. The color of hydrocele fluid is amber color and its specific gravity ranges from 1.022 to 1.024. Inorganic salts, albumin, fibrinogen. In long-standing cases, cholesterol and tyrosine. Due to presence of fibrinogen, when contact with blood, it may clot. So there is presence of fibrinogen in the hydrocele fluid. So whenever the hydrocele fluid comes in contact with blood, the blood gets clotted. So these are the composition of hydrocele fluid. So classification, basically we can classify hydrocele mainly into two types, the congenital hydrocele and the acquired hydrocele. And the acquired hydrocele gets further classified into two, as primary hydrocele and secondary hydrocele. The primary hydrocele, the cause are idiopathic. The secondary hydrocele, the causes are trauma and other disease. So basically the congenital and acquired hydrocele, and the primary hydrocele, the idiopathic cause, the postulated hypothesis just before we talked about the excessive absorption, excessive secretion and the defective absorption, right, defective drainage of lymphatics, right? So the primary hydrocele, and the secondary means if there is any trauma in the that region, in the testis, right, in the scrotal region, if there is any sort of trauma, if there is any sort of disease, right, orchitis, epididymitis or epididymorchitis. These are the secondary hydroceles, right? These are the causes of secondary hydrocele. So talking about clinical features, the hydrocele swelling is soft cystic swelling confined to the scrotum, right? The scrotal swelling, it is not the inguinoscrotal swelling, right? It is scrotal swelling confined to the scrotum. Get above the swelling, positive, right? We can get above the swelling, means we can palpate the spermatic cord structures just above the swelling, that is get above the swelling. Fluctuation test is positive, transillumination test is positive, fluid thrill is positive, and cuff impulse test is negative, right? So these are the clinical features and the tests, right? The get above the swelling, fluctuation test, transillumination test, fluid thrill, and cuff impulse test. So these are the main important features of hydrocele. So in this image we can see the pictures of hydrocele, right? This is also called watermelon scrotum, right? The penis gets depressed inside the scrotum. So there we can see hydrocele. There is the transillumination test positive is being demonstrated in this figure, right? So these are the clinical images of hydrocele. The differential diagnosis of hydrocele include inguinal hernia, right? Hematocele means there is accumulation of blood. Pyocele, the accumulation of pus. Tumor of testis, right? If there is any tumor in testis that may mimic hydrocele. So these are the differential diagnosis of hydrocele. The investigation of choice is the scrotal ultrasound, USG scrotum we can perform, where we can see the accumulation of fluid. So the complications of hydrocele, if not treated, that may get rupture, right? The rupture of hydrocele and infection of testis, long-term hydrocele, long-standing hydrocele. If it is not treated, it may lead to infection. It may lead to atrophy of testis, which leads to infertility, right? The testis gets atrophied due to persistent pressure, and it may lead to infertility, the calcification of hydrocele sac, and the herniation of hydrocele sac. So these are the complications related to hydrocele. So secondary hydrocele, the cause are the secondary hydrocele, it is caused due to pathology in testis or scrotum, right? As we already talked about the primary hydrocele and secondary hydrocele. The primary hydrocele, the causes are idiopathic, but the secondary hydrocele, there are other causes, right? The hydrocele occurs due to any other disease, right? For example, here it is given the acute epididymoarchitis, right? The inflammation of epididymis, the inflammation of testes, right? The chronic epididymoarchitis, tubercular infection of testis, the tuberculosis, right? Filariasis of scrotum, tumors of testis. So due to any of these disease, if there occurs hydrocele, then that is the secondary hydrocele, right? So due to any trauma or pathology in testis or scrotum, that is the secondary hydrocele. So talking about the management of hydrocele, right? The hydrocele is truly a surgical disease, right? So there's not like that there is any medicine to treat the hydrocele, right? It is truly a surgical disease. So the most commonly performed surgery is the Zabulese method of eversion of sac, right? And there are other methods also: subtotal excision of sac, total excision of sac, Lord's plication, right? So if the hydrocele sac is large, then we perform Lord's plication. We can perform tapping of hydrocele fluid, right? If the patient is unfit for surgery, then we can perform tapping of hydrocele fluid, and sclerosing therapy, the tetracycline, where it is used, the sclerosing therapy. And for the secondary hydrocele, we have to treat the cause. Right? What is the cause of the hydrocele? That might be epididymoarchitis, that might be tuberculosis, and that might be filariasis, right? So what is the cause? If we treat the main cause, then the hydrocele gets treated, right? So in the case of secondary hydrocele, the cause is treated, right? In case of primary hydrocele, it is truly a surgical disease, right? So we have to perform surgery. Thank you.